Many parents and professionals struggle with how to teach kids with autism how to dress themselves, how to shower, how to wash their hands, how to clean up for meals. So today I want to talk about how I learned through this book, Activity Schedules for Children with Autism, and how you can create little books to make self-care and other skills a lot easier to teach. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author of The Verbal Behavior Approach, How to Teach Children with Autism and Related Disorders, which is now available in over a dozen languages. Each week, I provide you with some of my ideas about turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So I have done some video blogs in the past on things like shoe tying, which you can check out. I haven't done a whole lot of videos though about how I taught Lucas and how I taught other clients how to dress themselves, how to wash their hands, how to use utensils, and all kinds of self-care and daily activities that often get in the way. I didn't say it in this video introduction, but in addition to being a behavior analyst and an autism mom, I'm also a registered nurse. And in the past, when I was a practicing registered nurse on a medical surgical unit in a rehab setting, I always worked with neurologically impaired patients who oftentimes had strokes or head injuries or brain tumors, and they had to learn, or relearn, I should say, to talk, to walk, to toilet train, to use utensils. And so a lot of my self-care practices that I now disseminate through my online courses and community are based a lot on my nursing background. I have a couple of examples that I want to talk to you about. So one time I was in a verbal behavior classroom, and it was early on. So this was probably 2004, 2005. And I was in a few classes, and I went to this one class, and it was an older child life skills class. So not everybody, all the students in there had autism. In fact, a lot of those students didn't have autism. They had other disorders like Down syndrome. And I remember we were talking about, this 14-year-old girl with Down syndrome, and the teacher was kind of upset because here we are going in, and some of the other consultants were using words like, the discriminative stimulus or demands and tax, and these things were not in this 14-year-old's IEP. And so the teacher was getting really upset. She was an older woman, and she looked at me the one day and she goes, that's not in her IEP. Not that she didn't care, but she just felt like we weren't working on the things that she wanted to work on. So I said to her, okay, so what do you want to work on? And she said, well, in her IEP, there is a goal for her to set the table. Okay, we can work on that, because ABA is the science of changing socially significant behavior. Setting the table for a 14-year-old with Down syndrome is a more than appropriate goal. We can do that. So I helped the teacher, and I said, okay, let's talk about setting the table. Can she do any parts of the table? And she was a little iffy on that. And I said, okay, so now we have to decide how we want her to set the table before we just try to teach her. So do we want her to carry all 4 plates over at a time? Do we want her to gather the 4 plates and the utensils, put them on top of the plate and carry it over? And she looked at me, she's like, I have no idea. I'm like, okay, well, let's decide, and then let's teach her the steps of setting the table. So everything can be broken down, and everything, especially when you're talking about self-care, leisure activities, vocational tasks, and chores, are chained procedures that shouldn't involve a lot of talking. It should involve shaping and chaining and reinforcement so that the child is eventually doing it on their own, which are different techniques than what we teach. What I teach within my book, for instance, is all really language development except for chapter 11, which talks about potty training and hand washing. And in that chapter, I do talk about a task analysis of writing the steps down to something. Another example is when we went to teach Lucas how to use knives and forks. So how to cut like a chicken tender up. And so because I'm his mom, the behavior analyst that was working on this goal came to me and said, okay, we want to teach Lucas how to cut up his chicken. How do you cut up your chicken? How does his brother cut up chicken? And then how does his therapist cut up chicken? And it was amazing. There were like, some people went through the tongs. Some people turned their fork over and cut like that. Some people kept their fork, and cut like that. It was amazing. So we need to break down the skill into a task analysis. In my book, in chapter 11, I break down the steps of hand washing, for instance. And really another pivotal point in my journey with Lucas and trying to teach him some of these skills was I read this book, which is a very old book. You could see it's very tattered in the front. And also, I'm going to show you this. Lucas used to, when he was little, scribble on things if you left him alone for a minute. So I wanted to show you that no longer happens. But I know people struggle with that. Okay, so this book was written in 1999, so it's 2 decades old, but it is a very good book by McClanahan and Krantz, and it basically shows you how to set up activity schedules. I also went on to create little books for Lucas. This is his morning book. He still uses this book, even though he knows the routine. This helps if there's me versus my husband versus another paid worker here, that it is Lucas's not routine, not the way I would do something or my husband would do something. So it just basically goes through the steps. Take your medicine, get out your turkey bacon, get your water out, put the bacon in the microwave for 2 minutes. You can see this is really helpful. Eat, clean up, sweep the floor, wipe off the counter, sweep the floor. Like he does that. And so in fact, we had a how to do wash book, and when my younger son Spencer was going to college, he's like, where's Lucas's little washing machine book? Because this can help anybody. It can help you teach kids learn to make a sandwich or to learn a whole routine. So for Lucas, we put whole routines in here. We have a bedtime routine when he gets a shower. He turns, so this picture causes him to turn on the shower, and then he flips the book, and then he sits on the toilet. He flosses his teeth. He brushes his teeth. He shaves. So all of these techniques really help. And so if you want to learn how to make these little books better, I would recommend this book. We also put a fitness routine, so you can do like 10 minutes on the treadmill, then lifting weights, whatever you want, you can put in little books. And this has really helped with Lucas's independence, and he is very familiar as we teach him new routines. If he gets a job, say as a janitor someday, we can break down the tasks, and we have, in terms of like how to clean the bathroom or how to clean off the counter. It's just a matter of breaking down the steps. And if you are going to use any kind of language, make sure you use for each step 5 words or less, and make that language consistent. I do show that in that shoe tying video that is on my YouTube channel as well. I break down the tasks into 5 words or less for each step, and then I fade out that language. eventually too. So hopefully you've enjoyed this short little video blog on how to increase self-care with these little books. If you liked it, share it, give me a thumbs up, leave a comment. And if you'd like more information about joining my online courses and community where we can really help you help your child or clients get to the next level and reach their fullest potential, you can attend a free online workshop at marybarbera.com/workshop. And I hope to see you right here next week.